So countries of particular concern at the moment. Now, Czechia, that's the Czech Republic, of course. Numbers have gone up and down incredibly, and they're now going up again. So still ongoing problems there, and we know the health facilities there are extremely challenged. Sweden going up, and Germany has levelled off to perhaps going up somewhat in Germany. Obviously concerns about the new variant. Now, talking about countries of concern, the drop-off in cases in the United States is less than it was. It's not dropping off as quickly. We can see there's a bit of a hook on the bottom there. And also the United Kingdom, the rate of reduction in cases has slowed down. We see a bit of a levelling off there as well. So quite a few things to keep an eye on, really. You're welcome. It's Wednesday, the 24th of February today. Now, what to do? A few things to do today. I think we'll probably start off by thinking about the United States, because the death toll in the United States is now 501,000. It's a grim milestone. Now, this is the actual live data from the Centers for Disease Control, but we know this is now not up to date, although this is live from their website, but we know the actual numbers are now well over 500,000. We see the numbers of cases going down, and we will see a slight levelling off in the reduction there in the number of cases. Deaths have gone down so slowly in the States, hence the large number, but are starting to go down now, thankfully. So that's the news from the United States. It is a sad period of time. Now, I just want to put this into some kind of context. 1918 pandemic, and this is the estimate from the Centers for Disease Control. It's the same source. 50 million at least died worldwide. We don't really know. It could have been as high as 80 million in the 1918 H1n1 pandemic. Now, this was an influenza pandemic. Now, I've been teaching students for 30 years that there will be another pandemic. It's inevitable. The virologists just say it's a question of when, not a question of if. But I expected it to be influenza. Didn't expect it to be coronavirus, but we do have another pandemic, as we knew we would. As we know we will in the future, in fact. The deaths in the United States then were 675,000 CDC estimate. So as of now, this is the official CDC figures of the number of cases. This is back to 2021. The number of cases and the number of deaths we now know is over 501,000, just over 500,000. Institute for Health Metrics and Evaluation have the best estimate I can find. On the 1st of June 2021, they expect there to have been another 89,000 deaths in the United States. Now, these numbers are quite horrendous, difficult to, well, they're not possible to comprehend, the statistics, aren't they? How can we possibly comprehend 500,000 tragedies? But the point is, this 89,000 figure of extra deaths between now and the 1st of June is negotiable. You can negotiate it up or down depending on your behaviour. It's not fixed. We know it depends on vaccine rollouts and other things, but it still depends massively on behaviour. So I think that's sort of just worth reiterating that this is an optional death figure in many ways. Now, trend-wise in the United States, at the moment it's good, but we are expecting an increase in cases in the end of February into March because of the new variants. That is the consensus of predictive opinion at the moment. But in the past 7 days, new daily reported cases down 19.5. Great. Daily reported deaths falling from a very high figure, but 15.5% down in the week. Hospitalizations down 13.2% on the week. Test positivity now at the epidemic threshold, 5%, going down. How much it will go up with the new variants, we don't yet know. Vaccine doses since the 14th of December, over 65 million. 2 doses have now been given to nearly 20 million people, representing nearly 7% of the US population. going out quickly. Not quite as quickly as the UK, not as quickly as Israel, of course, not as quickly as the United Arab Emirates, but going out for the size of the population in the States, it's good. It's going well. Of course, we always wanted to go faster. Now, I'm going to just skim through briefly the sort of reopening schedule for the UK. Now, if you're in the UK, you're probably vaguely familiar with this. If you're in the States or other parts of the world, you're not. I want to give it because it is a good example, and the devolved administration, Scotland, Northern Ireland, Wales are following very similar plans. They have very similar plans. They like to make them a little bit different, just to point out they're a bit different from the English plans, I think, sometimes. But basically, they're all similar. Now, the UK plans are not dates. Now, these dates were announced a few days ago, and people are rushing to book holidays and all sorts, but they're not dates. Let me just remind ourselves of the conditions. So, vaccine, the 4 conditions for these dates. So these are the dates we're going to look at for the 4 steps, are the earliest dates, depending on the vaccine programme continuing to go to plan, which at the moment it is. Secondly, reducing hospitalizations and deaths, which at the moment there are. Third, infection rates must not risk a surge in hospital admissions, protecting the NHS and healthcare provisions. And fourthly, new variants don't fundamentally change the risk of lifting restrictions. Now, at the moment, these are all being met. But I think you'll see that these actually do make perfect sense. There's nothing to argue with on that, really. These are the conditions for the carrying on reduction. We'll probably remind ourselves of those again in a minute. But let's just I'm just going to skim through this quickly, the schedules, the schedules for the UK. So UK, we've had actually well over 18 million doses of vaccine now. That's more than 24 hours out of date. England lockdown began the 4th of January. So it's been a long time. It's been a long haul. It's a 4-step plan that could see all legal limits on social contact lifted by the 21st of June. So this is the aim, that in July, conditions will be very near normal. Now, they're not going to be normal. There'll still have to be some restrictions. This is unequivocal. There are going to have to be some restrictions, like mask wearing, for example, into next winter. There's no doubt about that. But this is from the Prime Minister. Cautious but irreversible. He doesn't want to go back again. None of us want to go back again. Decisions based on data, not dates. So we do have to remember it is dependent on these 4 criteria continuing to being met. Now, the 5 weeks apart. Now, there's been a lot of political criticism over this 5 weeks apart. And without making a political point, I must say I agree with the 5 weeks that the government have come up with, because that's how long it takes to see if things are working. Remember, this pandemic is an oil tanker. You introduce restrictions or ease restrictions, and it just keeps on going for a while. It takes weeks to realise the effect of an intervention, or indeed the lifting of an intervention. So it takes a good 4 weeks really to see the effect of lifting an intervention. So making a decision in the 5th week is quite reasonable. So that 5 weeks is actually, it's not an arbitrary time, that 5 weeks. That's actually quite a scientific period of time over which to reevaluate an intervention, or in this case, the lifting of an intervention. Prime Minister does say, this is in italics, so it's direct quote, "No credible route to a zero COVID Britain, nor indeed a zero COVID world." Now, there's kind of 2 ways to look at this. We've got these 4 circulating endemic coronaviruses that cause the common cold. That's true. And it's also true there's been, I think, about 4 cases of Middle East respiratory syndrome reported in the past few weeks in Saudi Arabia. But the Middle East respiratory syndrome won't become a pandemic. It's not going to spread outside Saudi Arabia, or if it does nothing significantly, because people are infectious when they're sick. We can recognise it. And these 4 circulating common cold coronaviruses cause very, very minimal illness. But I still think that the SARS coronavirus 2 is most similar to the SARS coronavirus 1, which was eradicated in 2004. So I still think this is possible, but it is going to take some seasons. There's no question about that. Now, you might have caught that interview I did with Deutsche Welle News. And I said there in the UK we'll probably need a booster, third injection in autumn or winter. And Brent, the interviewer, said, "Are you sure about that?" You know, he was kind of taken aback by that, because it looks like we might need a vaccine every year for the next few years until this is potentially eradicated. So that is possible, because the virus will continue to mutate, and the more people that are infected, the more mutations there are going to be. So we are talking about a few seasons to eradicate this, but we know that the vaccine provides so much protection against being infected and severe disease, so it's going to be much less. In other words, the numbers could still remain reasonably high, but the morbidity, the mortality are going to go way down, because even though the numbers are higher, less people are going to get sick because of the vaccination effects. But I am optimistic we can get rid of this in a few seasons still. Now, I won't be able to apologise if I've got this wrong for a few seasons, so we're going to have to sort of hang on to this one for the time being, but that's still my feeling about this. Now, steps. Step one. Step one is actually step half and step one, actually. It's kind of divided into two, so but it is all step one. So England from the 8th of March, schools opening, testing in schools, and be able to meet outside 2 people for tea or a sandwich on a park bench. So that's from the 8th of March. 29th of March, outdoor gathering up to 6 people or 2 households. So it's kind of reintroduction of the rule of 6 really there, isn't it? This is going to include private gardens. So as spring comes, we can have people round for a cup of tea or a beer in the garden, which would be just brilliant. At least it's some form of social interaction again, isn't it? Outdoor sports will be allowed. So that's step one. Then 5 weeks later, step 2, 12th of April. Pubs and restaurants open for outdoor drinking. Now, by the 12th of April in England, it can still be pretty damp and wet. But you have nice days. So, I'm having a pint outside the end of April with friends. Yeah, that's something to look forward to. That really is something to look forward to. And non-essential retail open on the 12th of April. Hairdressers, some public buildings like libraries, 12th of April. Outdoor settings, alcohol takeaway, beer gardens, zoos and theme parks. So the focus is on outdoor here. Now, the message is now being hammered home somewhat by UK scientists that this ventilation is absolutely key. Outdoor, massively less risk than indoor. So it makes sense, but you can see we're kind of moving outdoor on the 12th of April. Indoor leisure like swimming pools and gyms. Now, I'm not clear what's going to be happening about that. It looks like some might be opening on the 12th of April. Some indoor leisure might be opening. I would imagine there's going to have to be limitations to the number of people that can go. Self-contained holiday accommodation and campsites like pods and tents where people are self-contained are going to open. The problem here, of course, is things like campsites and caravan sites is the shared toilet blocks. And the washing blocks, which could be an issue. It's still no indoor mixing between households, so it's not going to be indoor. Review of international leisure travel announced by the 12th of April at the earliest. So we will be able to fly after this time. Well, we're not going to know till the 12th of April. The announcement will be the 12th of April. Funerals and weddings increasing numbers. So we can see kind of a move outdoors there, which makes sense. Now, step 3. 17th of May, but it's 17th of May at the earliest, remember. If the data allows, remember it will depend on these 4 criteria being met. Outdoor mixing up to 30 people, 2 households can mix indoors. That's going to be a big one when you can have your friends around for a meal or for drinks. That's going to be a big one. Pubs and restaurants eating inside with a rule of 6, so 6 people could meet inside a pub or a restaurant. Cinemas, museums, hotels are going to open up to 10,000 spectators outdoor for football stadiums. That doesn't sound too unreasonable because these are all going to be outdoor venues, of course. And at that stage, the government is going to be saying something about the potential of a COVID status certification. Now, the idea of having some evidence of vaccine or evidence of immunity or evidence of having the infection is going to come for international travel. No question about it. It's going to come. So if you want to travel internationally, you're going to have to accept some sort of green passport. Is it going to be on a mobile phone? Probably. Apps are being developed now. Is it going to be a physical piece of paper? Could be. Is it going to be something that's actually electronically on your passport? Could be. It has to happen for international travel. The level that happens for domestic events is going to be announced on the 17th of May. Now, the people that comment and write into me about this, the vast majority of them are emphatically against this on civil liberties grounds, but I suspect they're the most vocal minority. Personally, I can't really see an alternative. What are we going to do? Allow spreaders to go to a pub, super spreaders to go to a pub? I just don't see how that can happen. I think this is inevitable, but that'll get me another slew of comments as well, but that's my view. Take it or leave it. Step 4, from the 21st of June, potentially see all limits on social contacts removed. Nightclubs, big risk, of course, that they're going to potentially reopen 21st of June. All restrictions on social gatherings basically lifted. But let's just re-emphasise, it is going to depend on these conditions being met as we go along. Vaccine programme continues to go to plan. We do expect that's going to happen. Vaccines reducing hospitalizations and deaths, I am sure that is going to happen. So conditions 1 and 2, I'm sure, are going to be met. Infection rates do not risk a surge in hospitalizations. Again, with the vaccinations reducing people that are getting sick, I suspect that's going to be met. The 4th one, new variants do not fundamentally change the risk of lifting restrictions. We haven't got a clue about that one. Now, I'm going to finish off with a couple of other countries where data is very limited. I think first of all we'll look at the country that was called Burma when I went there. Now, data very limited. Everything I'm going to tell you comes from this article from Burmese doctors or Myanmarian doctors in the Lancet. So everything I say is straight out of this paper from the Lancet, which I thought was probably the most definitive source I could find. Of course, the popular press is full of many accounts of this, and I'm sure many of you are as distressed as I am by the goings on, tragic goings on in Myanmar. New Delhi confirmed cases COVID-19 per million, relatively low numbers of cases per million. But of course, we've got to consider the testing. So looking at that, looks like the pandemic's gone away in Myanmar. But when we look at the testing to compare that to, well, we see that the testing's gone away as well. So what this means is we didn't have much idea before the coup about what was going on in Myanmar. Now we have no idea whatsoever because the testing's not there. Anyway, let's stick to what we do know. Data from the Lancet. 19th of February. Military coup was the 1st of February. There's a big civil defence movement going on civil disobedience movement going on in Burma. And this is also affecting healthcare providers in quite a big way as well. So this is having an effect as well as the direct effect of the military takeover. Direct quote from the article, clinical services have drastically diminished, leading to a health system suddenly in crisis. Let's make no mistake about it, the health system in Burma, in Myanmar, is currently in crisis. Decades of underinvestment in the public sector. Now, the military do have their own hospitals, so it's not really affecting the elite, but the vast majority of people in Myanmar, it is affecting. Decades of underinvestment. Now, there are private and charity and church-based hospitals in Myanmar, but their capacity is very limited. So one can assume they're pretty busy at the moment. Busy public emergency departments were performing the screening, testing and early critical care for COVID-19. The degree to which this is going on now, we know is reduced. It's unclear how much it's reduced, but we think significantly. Immunisation programme had commenced, again past tense unfortunately. Mass public rallies and protests going on, public communication and goodwill for isolation, I think we can currently say is limited or difficult to impossible because of the security situation. Again, direct quote from the paper. Myanmar risks profound health system collapse. Global isolation and sanctions are going to make things worse. So that's all from the Lancet. That's all the data I have at the moment. Anything else you'll get from popular news outlets. But let's just spare a thought for the people of Myanmar at the moment. And the other people, of course, I'm sure everyone's heart goes out to is the idolatrous regime in North Korea, which shows no sign of abating. Now, this is a joint statement from Germany, Belgium, Dominican Republic, Estonia, France, United Kingdom, United States and Japan, part of the United Nations Security Council. So this is agreed by all of these countries. So this is not my view. This is agreed by the governments of these countries. People in North Korea stripped of nearly all their human rights, including freedoms of expression, peaceful assembly, association, movement and religious belief. So there's no freedom of worship in North Korea. No freedom of peaceful assembly. I mean, these are just rights that we adore in the West, and a whole people group here don't have them. I work with South Koreans in the university in Cambodia, and the South Koreans used to cry over North Korea, literally. just so appalling situation, and appalling and getting worse by the day is direct quote. These are all direct quotes from this agreed communique. Prioritise its nuclear weapons program over the need of its people. That seems to be happening. Long-standing, systematic, widespread, gross violations of human rights, serious threat to international security. Again, not my views, just direct quotes from the United Nations communication. Isolation from the international community is inevitably worsening the impacts of the pandemic on the North Korean population. How badly they are suffering, we don't know. We know that the nutritional status in North Korea is one of the worst. Probably one of the worst in the world, really. I mean, there are nutritional difficulties in many countries, of course, but North Korea is, for what is supposed to be a relatively advanced country, it's bad. So that's going to immunosuppress people. Now, this doctor is, I'm not giving away any secrets here, he's in the Deutsche Welle news report. He defected from North Korea in 2012. Healthcare system is very weak, he says. They don't want to show that to the world, they're hiding it. North Korea is a museum for viruses. I assume that means he thinks there's a lot. So it doesn't look good. But fortunately, we've been reassured by Kim Jong-un, the dictator of North Korea. There's not a single coronavirus case on North Korean soil. So good job, there's nothing to worry about after all. There you go. Just appalling situation in North Korea on many different levels. So what do we do about that? I don't know. But we will spare a thought for the people suffering in those two countries. And that's it. That's us for today. Oh, now just on a separate note. Now we tested my vitamin D levels a couple of weeks ago. Getting on for a couple of weeks ago now, and we did this. I have no commercial interest in these. We did this one, your personal vitamins one. That was the cost of that one, and mine came back at 22, which was surprisingly low. So I did want to test it against an NHS test. So I sent off an NHS test at the same time. That was from this one, Better You. 32.95. They agree. It goes to an NHS lab, so I thought that was fantastic. They agree to get back to you within 10 days, and I think it's been 9 days now, and they haven't so far. So lots and lots of people have been asking about that. The answer is you know as much as I do, because they haven't got back to me. Okay, that is us for this video. Of course, thank you for your time and thank you for watching.